Let's discuss the Chinese medical theory, Chinese versus Western medicine. The traditional Chinese medicine has been charged with being unscientific because of the theory on which it is based involves entities like Qi and meridians that appear ambiguous, and because the internal organs like the kidney and the spleen are understood very differently from those of modern anatomy and physiology. Furthermore, TCM methods of therapy based on the ancient principles of yin and yang and the five elements, as well as the classification of illness by constellations of symptoms known as TCM syndromes, are largely unproven by the clinical trial protocols of modern evidence-based medicine. Let's discuss the Chinese versus Western medicine. Chinese medicine refers to the system of medicine that has been practiced in China since ancient times. It is based on a body of theory that does not incorporate the scientific advances of Western medicine in modern times. In particular, the discoveries of microbiological agents like viruses and bacteria, as well as the enormous expansion in the understanding of human physiology and molecular biology since the advent of the scientific revolution in 7th century Europe. Chinese medicine practiced as an alternative to modern Western medicine in scientifically developed China and other East Asian countries is as much an anachronism as would be an ancient Greek and Galenic medicine were they to be practiced in Europe today. Yet in developed East Asian countries and some Western countries as well, it is indeed a serious alternative system taught in state-accredited university medical degree courses complete with graduate and research programs. Chinese medicine was practiced in China as a mainstream medicine well into the second half of the 20th century, following the large-scale introduction of Western science in the wake of the May 4th movement of 1919, the Chinese Enlightenment. Western medicine rapidly gained around over Chinese medicine in public health care. By the 1970s, there were more Western physicians than Chinese physicians. Nonetheless, even today, Chinese medicine continues to play a significant role in healthcare, particularly in rural areas of the country. Controversy over the validity of Chinese medical theory and the case for continuing state support for it was an inevitable consequence of the May 4th movement. Young nationalists wary of the technological backward China that suffered repeated incursion into its territories by Western powers following the Opium Wars in the mid-19th century, viewed in the adoption of Western science and technology and democratic principles as the only way to revive the nation and restore its former glory. Young scholars returning from the universities in America, Europe, and Japan saw Chinese medicine as a relic of China's scientifically backward past and mounted a campaign to eradicate it and replace it with Western medicine. A public debate broke out in the 1920s when Yu Yan, who studied Western medicine in Japan, proposed the replacement of what he deemed unscientific Chinese medicine by Western medicine and the abolition of all Chinese medical practices other than the use of herbs whose alleged therapeutic properties would be subject to research by clinical trials. The robust response in Chinese medical fraternity, led initially by Yun Tikiao, set the stage for acronymous debates that raged for over 20 years. The conflict enjoyed a respite during the Civil War, followed by the ascendancy of Mao Zedong in the 1949 revolution. Mao, a believer in Chinese medicine but impressed also with the great advances made by Western science and medicine, declared Chinese medicine to be a treasure trove of Chinese wisdom, ordered its modernization and encouraged its integration with Western medicine. By edict, the training of doctors in Western medicine included courses in Chinese medicine. They were encouraged to use Chinese medicine in combination with Western methods, thereby lending a treasure of scientific legitimacy to the former. Some observers interpret this as part of Mao's political agenda to show that the Chinese also had technology and knowledge from which the West could equally learn. Thank you for your attention.
Interviewing techniques. When we listen to the patient, we should not only listen to what they are saying, but also to the sound of their voice and its tone, speed, and strength. We should also observe their body language, posture, and eyes, speed and strength of their body movements. These things are not an aspect of this diagnostic pillar, but interviewing the client gives us ample opportunity to observe the person. It does require a degree of multitasking to focus intellectually on the conversation and the information that is being given, whilst trying to observe visually and listen to the more subtle diagnostic signs emanating from the client. Interviewing the client is perhaps the most accessible of the four diagnostic approaches, but it can also be the most difficult because it is not always easy to get the information you need from the client. This may be because the client is not particularly aware of their bodily functions. They may consciously or subconsciously not want to answer all the questions that we ask. The opposite is often also the case. The patient tells you too much. These patients can start to take control of the conversation, or they relay to you too many details and a surfeit of information that has no relevance to what you are asking them about. This is a problem because you only have a limited amount of time set aside for each patient, and because it can be very exhausting as a therapist to spend so much energy staying focused and trying to steer the conversation back to the topic. Patients with heat in the heart are typically problematic in this way. Heat in the heart means that they are over-communicative. Their Shen can have difficulty distinguishing between what is relevant and irrelevant, and it cannot control how much they open up to others. What they say may have relevance for the diagnosis, but often they begin to talk about something other than what you ask them about. It is, of course, an important diagnostic sign in itself that they are talking and telling you so much. It is perhaps only this and the red tip on the tongue that tell you that they have some form of heat in the heart. Once you have established this, it is important that you gain control of the interview again. It is important to learn how to cut people off in a polite and courteous manner. This can be difficult because they might feel that what they are telling us is relevant to their situation, or that they are paying you to listen to them. It may also be that what they are telling us has a great deal of relevance to their imbalances, but that we do not possess the relevant therapeutic skills to help them as a counselor. This could, for example, be a woman who says that she has been subjected to incest or rape. This will be an extremely important etiological factor, but after we have listened and sensed how it affects and has affected her, it is not our job as an acupuncturist to provide her with psychological counseling. We are not qualified to do this. We can offer empathy and we can give her the space to talk about it, but we must also be conscious of where our therapeutic tools and skills start and stop. In these situations, we must refer the client to others who possess these skills. We can, importantly, help her on the energetic level, and people who have undergone several years of counseling often experience a therapeutic breakthrough as a result of acupuncture. This, though, is through the actions of the needles and herbs and the space we create, not through our abilities as amateur psychotherapists. Respect, sensitivity, and being non-judgmental are key words when interviewing clients. The patient must always feel that you have respect for them, that they can trust you, and that you do not judge them. The latter is something most clients are excellent at doing themselves, and they do not need any additional help. It is a great leap for some people to contact an acupuncturist or herbalist, as this is something that they may perceive of as being alternative or even mystic. It is important that they understand why we ask so many questions that can seem irrelevant and even strange. They may well have thought that it was enough to say that they suffer from migraines, that you would then stick some needles in the headache point, and that would be all. It is therefore a good idea to explain how in Chinese medicine we are constantly looking for patterns and relationships rather than isolated symptoms. You should explain to them how ostensibly disparate symptoms and signs can relate to a specific organ's functioning. For example, that the soreness in their knees and their tinnitus can relate to the kidneys, and that these signs, therefore, have relevance in the treatment of their night sweats, something that they have been told is hormonal. It is also important to inform the client of the difference between the Western medicine and Chinese medicine concepts of the internal organs. For example, when we say that there is an imbalance that relates to their liver or heart, this does not mean that they have cirrhosis or that they are about to have a cardiac arrest. We must explain to them that organs in Chinese medicine are more about functional relationships than physical structures. Thank you for your attention.
Now let's talk about the theory of Yin-yang and its application to medicine. It could be said that the whole of Chinese medicine, its physiology, pathology, diagnosis, and treatment can all be reduced to the basic and fundamental theory of Yin and Yang. Every physiological process and every symptom or sign can be analyzed in the light of Yin-Yang theory. In treatment, all strategies boil down to four. First, tonify Yang. Second, tonify Yin. 3, eliminate excess Yang. And 4, eliminate excess Yin. Understanding the application of the theory of Yin-Yang to medicine is therefore of supreme importance in practice. One can say that there is no Chinese medicine without Yin-Yang. Yin and Yang and the body structures. Every part of the human body is predominantly Yin or Yang in character, and this is important in clinical practice. It must be emphasized, however, that this character is only relative. For example, the chest area is Yang in relation to the abdomen because it is higher, but Yin in relation to the head. As a general rule, the following are the characteristics of various body structure. Yang is superior, while Yin is inferior. Yang is exterior, while Yin is interior. Yang is the posterior lateral surface, while Yin is the anterior medial surface. Yang is the back, while Yin is a front. Yang is function, while Yin is related to structure. More specifically, the Yin and Yang characters of the body structures, organs, and energies are as follows. So the back is ascribed to Yang, the front and the chest abdomen to Yin. The head is Yang, and the body is Yin. The exterior, the skin and muscles is Yang, while the interior or the organs is Yin. The areas above the waist is Yang, while the areas below the waist is Yin. The posterior lateral surface of limbs is Yang. The inferior medial surface of limbs is Yin. The Yang organs is Yang, while the Yin organs is Yin. The function of the organs is Yang, while the structures of organs is Yin. Qi is Yang, while blood and body fluids is Yin. Defensive Qi is Yang, while the nutritive Qi is Yin. Here is an illustration showing the body structures. The anterior aspect is Yin, while the back or the posterior aspect is Yang. The areas above the umbilicus is Yang, while the areas below the umbilicus is Yin. Now let's talk more about the back and front. The back is the place where all the yang channels flow. These carry yang energy and have the functions of protecting the body from exterior pathogenic factors. It is the nature of yang to be on the exterior and to protect, while it is the nature of yin to be in the interior and to nourish. Thus, the channels on the back belong to yang and can be used both to strengthen yang and therefore are resistant to exterior pathogenic factors and to eliminate pathogenic factors after these have already invaded the body. The front, which is the abdomen and the chest, is the place where all the yin channels flow. These carry yin energy and have the function of nourishing the body. They are often used to tonify yin. Now let's talk about the head and the body. The head is the place where all the yang channels either end or begin. They therefore all meet and flow into each other on the head. The relation of the head to yang energy is verified in different ways in practice. First of all, yang energy tends to rise, and in pathological situations, heat or fire will tend to rise. Since the head is the topmost area of the body, yang energy, be it physiological or pathological, will tend to rise to the head. In pathological circumstances, this will cause red face and red eyes. The head is also easily affected by yang pathogenic factors such as wind and summer heat. Finally, the head being the convergence place of all the yang channels, points in this area and can be used to raise the yang energy. The rest of the body, the chest and the abdomen, pertains to yin and is easily affected by yin pathogenic factors such as cold and dampness. Thank you for your attention.
Let's discuss the extraordinary yang organs, the uterus. The 6 extraordinary yang organs complete and integrate in the picture of the internal organs in Chinese medicine, as they include structures and the function that falling under the umbrella of internal organs, notably the uterus and the brain. They are called extraordinary yang organs because they function like a yin organ that is storing yin essence and not excreting, but have the shape of a yang organ that is hollow. All the 6 extraordinary yang organs store some form of refined essence, such as marrow, bile, or blood. Functionally, they are all directly or indirectly related to the kidneys. Another characteristics that they share is that most of them are cavities, for example, the skull, containing the brain, the blood vessels, the bones, the gallbladder, and the spine. So we have here the 6 extraordinary yang organs. Number 1, the uterus, the brain, the marrow, the bones, the blood vessels, and the gallbladder. Each extraordinary yang organ is related to particular internal organs as follows. The uterus related to the kidney and liver, the brain with the kidneys, marrow sa kidneys, bones to the kidneys, blood vessels to the heart, the gallbladder to the gallbladder. The uterus was called by Sibao in Chinese medicine. Bao is actually a structure that is common to both men and women, in which it is the lower field of elixir, the dantian. In men, Bao is the root of essence. In woman, the uterus. Chapter 36 of the Classic of Difficulties says, the gate of life, Mingmen, is the residence of the mind, the Shen, and the essence, the Jing, and it is connected to the original Qi, the Yuan Qi. In men, it houses the sperm. In women, the uterus. So we have here the uterus and the lower dantian. From the Bao, which is the lower dantian. In men, it is the room of Jing, which produces the sperm. In women, the uterus, Sibao, which produces the menstrual blood. The uterus is the most important of the 6 extraordinary young organs. It has the function of regulating menstruation, conception, and pregnancy. Yin organs store essence and do not discharge. The yang organs do not store, but are constantly filled and constantly discharged. The uterus functions as a yin organ in that it stores blood and the fetus during pregnancy. It functions as a yang organ in that it discharges blood at menstruation and the baby in childbirth. So we have here the function of the uterus. As a summary, it regulates menstruation. It houses the fetus during pregnancy. So the relationship between the uterus and the extraordinary vessels, and that between the uterus and the internal organs. Okay. So we have here the uterus as an extraordinary young organ, the shape of sang. So it stores fetus and stores blood. While in the function of a fu, it discharges blood and discharges baby. Thank you for your attention.
Let's talk about the treatment principles, the root and manifestation. After making a diagnosis and identifying the patterns, the next logical step is that of determining the principle of treatment to be adopted. The practitioner of Chinese medicine will need to formulate a rational and coherent plan of action as to what should be treated first, what is primary and what is secondary in the patient's condition, what is the relative importance of the acute or chronic condition, and what method of treatment should be used. Over the centuries, Chinese medical theory has answered these questions and provided a coherent system of principles of treatment. In practice, these principles provide a logical framework according to which a practitioner can evaluate the objectives of his or her treatment. A principle of treatment should always be established before treatment commences. This is achieved by a rigorous analysis of the clinical manifestations and a synthesis of the patient's condition and therapeutic needs at that particular time. The principles of treatment do not necessarily follow logically from the identification of the relevant pattern of disharmony, except in a few simple conditions. Most of the conditions we see in practice are characterized by multiple patterns and a coexistence of deficiency and excess. Thus, although our diagnosis of the patterns involved may be absolutely correct, the success of the treatment depends very much on the adoption of the correct strategy and method of treatment. For example, although we may correctly diagnose spleen deficiency and dampness, should we concentrate on tonifying the former or eliminating the latter, or should we do both simultaneously? The adoption of the correct treatment principle in deciding whether to tonify the body's qi or eliminate pathogenic factors is absolutely crucial to the success of the treatment. The adoption of the correct treatment principle in deciding whether to tonify the body's qi or to eliminate pathogenic factors is absolutely crucial. Thus, the therapeutic encounter starts with diagnosis, using the tools of observation, interrogation, palpation, and hearing or smelling. Using these tools, we identify the patterns of disharmony. After that, we need to identify and evaluate carefully the root and manifestation, distinguishing between fullness and emptiness. It is only after doing this that we can formulate a suitable treatment strategy and method. Two main meanings of root and manifestation. The root is the root of the condition, for example, wind cold, and the manifestation is the clinical manifestations, like aversion to cold, fever, floating pulse. The root of the condition is the original pattern, for example, spleen qi deficiency, and the manifestation is the deriving pattern, for example, dampness. So the tools of diagnosis are the 4 pillars: observation, interrogation, palpation, hearing, smelling. Then we identify the patterns. Is it pattern A, B, or C? Then we identify the root and manifestation, and to identify whether it is full or empty. Then we come up with a treatment principle. A few examples will clarify this. A patient with chronic bronchitis presents with an acute attack of wind cold or wind heat. A common cold or influenza, for example. Should we treat the acute attack first and ignore the chronic condition? Or should we treat both at the same time? A patient with deficiency of Qi causing great tiredness also has symptoms of dampness and a thick, sticky tongue coating. Should we concentrate on tonifying Qi or on eliminating dampness, or on doing both simultaneously? A patient has been having a recurrent temperature and flu-like symptoms for weeks. She is completely exhausted, but her pulse is full and wiry. Should we tonify her body's Qi or expel the exterior pathogenic factor still lingering in the interior? An old man has deficiency of Yin with rising of liver Yang causing hypertension. We need to reduce liver Yang, but as the patient is old and frail, will reducing liver Yang weaken his energy? An elderly patient suffers from a kidney deficiency, but also from pronounced blood stasis, phlegm, and heat. Should we concentrate on tonifying the kidneys or on invigorating blood, clearing heat, and resolving phlegm? Or should we do both simultaneously? If we choose to invigorate blood, resolve phlegm, and clear heat, would that weaken this elderly person? These are a few examples of complex situations encountered in clinical practice every day, requiring a clear differentiation between what is primary and what is secondary, an assessment of the patient's condition, and a clear principle of treatment and plan of action. Thank you for your attention.
Let's discuss diagnosis according to Zhangfu organ patterns, in particular, lung imbalances. In this diagnostic model, patterns are differentiated in relation to changes in the functioning of the Zhangfu organs. What has elicited these changes can both be external influences such as climate, diet, emotions, and lifestyle, as well as internally generated imbalances such as heat, dampness, yang deficiency, and others that are affecting the functioning of the organ. When the Zhangfu organ is negatively affected, it will manifest symptoms and signs that relate to a disturbance of its physiology, as well as signs and symptoms that relate to the tissues, sense organs, emotions, vital substances, etc., that are influenced by this organ. The diagnosis will be based both on changes in the organ's physiological processes and changes that are manifesting on the exterior of the body, such as changes in the skin color, sound of the voice, pulse, tongue, etc. The Zhangfu diagnoses are often Now let's go to lung imbalances. The lung has several functions, the most important being that it controls Qi and respiration. Along with the kidneys and spleen, the lung is responsible for the production of Qi in the body. Zhong Qi, which is created by the lung, is the foundation of Zhen Qi. This means that all the organs are dependent on the lung, as well as the kidneys and the spleen. If the lung Qi is weak, it will affect all other organs of the body. The lung is the only Zhang organ that is in direct contact with the world outside of the body. The lung is in contact with environment through the upper respiratory tract and through its related tissue, namely the skin. Wei Qi, which is spread by the lung, circulates under the skin and is the first aspect of Qi that is affected when there are invasions of exogenous Qi. This makes the lung vulnerable to exogenous influences. It is for this reason that the lung is called the sensitive or the delicate organ. The etiology of lung imbalances. As described earlier, the lung is in direct contact with the environment through the respiratory tract, the skin, and the Wei Qi. This means that exogenous Qi can be a very important etiological factor in lung imbalances. Wind is the spearhead that can pierce through the Wei Qi and lead other points of exogenous Qi into the body. Qi will initially be combated by, but will also block Wei Qi. Because it is the lung that spreads Wei Qi, the blockage of Wei Qi will have a stagnating effect on lung Qi. If Qi is not expelled, it can penetrate deeper and affect the lung more directly. Wind, cold, damp, and heat are the forms of exogenous Qi that we most often meet in the clinic in Western Europe, Northwestern Europe. It is important to remember that the lung is also very vulnerable to dryness because it is a lung organ that is in direct contact with the air. If the air is dry, it can desiccate the lung and injure lung yin. Although this has not traditionally been a problem in a maritime climate, it is something that has become more relevant over the years due to interior environment of modern buildings, especially buildings made of concrete. Furthermore, it may be a problem in very cold regions where the air can be very dry in the winter. Damp and phlegm in the lung can arise when exogenous Qi condenses and congeals in the lungs so that it transforms into phlegm. Chronic phlegm in the lung, though it is often the result of an imbalance of the spleen. There is a Chinese medicine saying, phlegm accumulates in the lung, but it is created in the spleen. This is because the spleen sends good Qi up to the upper jiao, where the lung creates long Qi. If there is spleen Qi deficiency, or if cold or damp and phlegm creating foods are excessively consumed, the damp and phlegm that are generated will ascend together with the pure Qi up to the lung from the middle jiao. This has great importance in the relation to the treatment strategy when treating lung phlegm imbalances. Food and drinks that create heat in an organ can also affect the lung due to its physical position in the body. The lung is a canopy that arches across the other organs in the top of the body. If these organs are affected by heat, or if there is heat generated by one of these organs, the heat can rise up to the lung due to the yang nature of heat. The spicy flavor is very dynamic and moves from the center to the periphery. The spicy flavor is therefore used, amongst other things, to open the exterior. That is, the spicy flavor can induce a sweat. This is fine when Wei Qi is blocked by exogenous Qi, but if the spicy flavor is excessively consumed, it will weaken lung Qi and lung yin. Lack of nourishment, such as eating too little or eating food that is of poor quality, can lead to a generalized Qi deficiency condition that is thereby also lung Qi deficiency. The lung inhales air from the environment. The air is known as Da Qi or great Qi in English. This means that the quality of the air that is inhaled is of great importance for the lung, as lung Qi is dependent on whether the air is fresh and pure. This is the reason that people get tired and sleepy in rooms where the air is heavy. Air pollution can also create imbalances in the lung. This can be seen in allergic reactions as well as in chronic ailments. Although air pollution does not fall within the traditional Chinese categories of exogenous Qi, it can still be defined in relation to these imbalanced categories by analyzing how it affects the body. If an allergen or pollutant creates symptoms and signs, such as those seen in wind heat, for example, This allergen or pollutant will be defined as having a warm nature and will be treated accordingly. In this context, it is appropriate to mention tobacco smoke. This is a form of pollution that many patients will have been exposed to, both voluntarily and involuntarily. Tobacco smoke is warming and drying in its energy. This means that it is likely to injure lung wheel, create heat in the lung, and boil fluids in the lungs so that they congeal into phlegm. Furthermore, the combination of heat and phlegm can lead to the creation of blood stagnation and toxic fire in the lung. Blood stagnation, toxic fire, and phlegm in the lung are three of the most important precursors to lung cancer. The lung descends and spreads Qi and Yin throughout the body. When there is an inhalation, the chest opens and Qi is sent downwards and outwards. Poor posture can impede this function. If a person sits or stands in a stooped way with a sunken chest, this will burden the lung because it has to use more force to spread Qi out from the chest. The lung is emotionally affected by sorrow, melancholy, and worry. These emotions encompass many other and more nuanced emotions, but common to many of these is that they debilitate and bind lung Qi. Therefore, emotions such as powerful, prolonged, or unprocessed grief, worry, or speculation can weaken lung Qi and stagnate Qi in the chest. The lung cooperates closely with several of the other Zhang organs, as well as its partner organ, the large intestine. There are therefore often combined patterns when there is chronic lung imbalance. The lung and liver are both involved in spreading Qi, and there will also blood through the body. Disturbances of these organs' Qi can therefore affect one and the other. Furthermore, liver fire can invade the lung. The heart and the lung have a very close relationship in terms of their physical location, and especially in relation to Zhang Qi and moving blood through the channels and vessels. The kidneys, urinary bladder, and lung cooperate in relation to fluid physiology, and lung yin is nourished and moistened by kidney yin. Furthermore, lung Qi is grasped by kidney yang. The spleen, stomach, and lung are closely involved in the transformation and transportation of Qi and Ji. Finally, the lung and the large intestine's relationship is seen not only in that lung Qi deficiency can lead to constipation, but also in that constipation can disrupt the lungs' sinking function, leading to difficulty in breathing. Thank you for your attention.
Let's discuss the diagnosis according to the 8 principles. Diagnosis according to the 8 principles is relatively new. It was first described as a single model in the early Jing dynasty and around the year CE 1680 by Zheng Zhongling. The differentiation of individual principle is, however, seen in books as old as the Yuan Di, Neijing, and Sanghan Lun. In the 8 principle diagnosis, the patterns are differentiated in relation to 4 opposite pairs. These pairs are yin and yang, hot and cold, interior and exterior, deficient and excess. Each element has specific symptoms and signs that characterize it, and these symptoms and signs are used to differentiate it from its counterpart. If there is heat, for example, there may be symptoms and signs such as thirst, dark urine, and a red face, a rapid pulse, and a red tongue. If there is cold, there will be no particular thirst, and the urine will be clear, the face pale, and the pulse slow, and the tongue pale. The 8 principles are ultimately only 2 principles, the yin and yang, where the other 6 principles are subcategories of refined of these 2 principles. Diagnosis would be incredibly simple, but not very useful if we just differentiate between yin and yang, so it is necessary to further refine and differentiate the symptoms and signs. It also means that the 6 subcategories can be combined in many different ways. This makes situations more complex because you can, for example, combine yin categories such as interior with yang qualities such as heat, and you can then combine this with zhu or shi. The image becomes 3-dimensional and more intricate. As described, the pairs can be combined in pairing combinations. Furthermore, it is necessary to utilize all 4 differentiations to create a diagnosis. It is enough, for example, in an invasion of wind cold to state that it is exterior Qi cold, or if there is blood deficient, to state that there is an interior deficient condition. A diagnosis will frequently consist of multiple simultaneous individual diagnoses. There may also be contradictions within the same category. It's not an either-or differentiation, but can quite easily be both and diagnoses. For example, you can have both interior deficient heat and exterior excess cold at the same time. This could be a person who is kidney yin deficient who has been invaded by exogenous wind cold. Diagnosis, according to the 8 principles, is the basis of all TCM diagnoses. The difference between this and other diagnostic model is that the 8 principles can be and is used every time we make a diagnosis. All differentiation relies on distinction between the 8 principles. Other diagnostic models are relevant in specific situations and usually involve the 8 principles in their diagnosis. If, for example, when making a diagnosis according to Qi, and Jingyi, you have a diagnosis of blood deficient, it is implicit with this diagnosis that it is an interior deficient condition according to the 8 principles. The 8 principles may appear to be very simplistic, but because these principles are involved in all diagnostic scenarios and because the individual components of the situation are differentiated separately, there is no situation too complex to be analyzed using the 8 principles. On the contrary, when something appears to be complex and confusing, you can always take a step back and assess the entire situation from 8 principles perspective. There are often situations where there are many different symptoms and signs, and it is difficult to gauge which organ are involved and whether it is Qi or blood that has stagnated or where there is phlegm and so on. These situations, you can always ask yourself, what is the overall impression? Is it an interior or exterior condition? Is it deficient or excess, hot or cold, and then proceed again? The 8 principles form the foundation of all treatment strategies and acupuncture point selections. The 8 principles are also a way of clarifying a diagnosis. For example, if a patient coughs, we know that it is a lung imbalance. Because they cough, we also know that there is a rebellious Qi. To treat the cough, though, it is important to know whether the imbalance is the result of interiorly generated or exogenous evil Qi, whether it is a deficient or excess condition, and whether there is heat or cold. All of these things will have to determine which acupuncture points or herbs are used and whether the acupuncture points should be tonified or drained. Thank you for your attention.
Let's discuss the following patterns for cough: lung Qi deficiency, lung Yin deficiency, and lung dryness. Lung Qi deficiency is manifested by slight cough with low sound, no phlegm, spontaneous sweating, propensity to catching cold, weak voice, tiredness, and pale face. Tongue is pale, pulse empty. Treatment principle: tonify lung Qi and restore the descending of lung qi. Points: lung 9, bladder 13, lung 7, bladder 43, ren 12, stomach 36, spleen 6, all needled with reinforcing method. Moxa is applicable. Lung 9 and bladder 13 tonify lung qi and stop the cough. Lung 7 restores descending of lung qi. Bladder 43 nourishes lung yin and is specific for chronic lung problems. Ren 12, stomach 36, and spleen 6 tonify both spleen and lungs, since the lung channel starts in the middle burner. Lung yin deficiency manifests as dry cough in short bursts and with a low sound, scanty phlegm or none, blood-flecked sputum, dry throat, feeling of heat in the evening, night sweating, thin body, extreme tiredness, tongue without coating, dry with lung cracks. If there is empty heat, the body is red, pulse floating empty. Treatment principle: nourish lung yin, moisten the lungs, clear empty heat if necessary, restore the descending of lung qi, and stop cough. Points: lung 9, lung 1, lung 10, ren 12, stomach 36, spleen 6, lung 7, and kidney 6, all needled with reinforcing method, except for lung 10, which should be reduced. No moxa. Lung 9 and lung 1 nourish lung yin. Lung 10 clears lung empty heat. Ren 12, stomach 36, and spleen 6 tonify the spleen to nourish lungs. Lung 7 and kidney 6 in combination open the directing vessel or renmai, benefit the throat, nourish lung yin, restore the descending of lung qi, and stop cough from lung yin deficiency. Lung dryness, clinical manifestations: dry cough with a low sound, dry throat, and mouth. Tongue is dry, pulse floating empty. This is a condition of dryness of the lungs, and although it does not show all the symptoms of yin deficiency, it is a state that often precedes yin deficiency. It frequently occurs in people with a predisposition to lung deficiency, who, through their work, need to use their voice a lot, such as teachers. In such cases, it is usually associated with deficiency of stomach yin because the stomach is the origin of fluids. This pattern may also arise following invasion of wind heat that dries the lungs' fluids and leads to dryness with some residual heat or phlegm heat in the lungs. It is manifested with a very dry and ticklish cough immediately following an invasion of wind heat. The cough is very persistent and is worse at night. Treatment principle: moisten the lungs, restore the descending of lung qi, and stop cough. Points: lung 9, lung 10, ren 12, lung 1, stomach 36, spleen 6, lung 7, and kidney 6, all needled with reinforcing method except for lung 10, which should be reduced. No moxa. Thank you for your attention.